You know, getting a diagnosis can be pretty scary, whether it's a chronic condition, whether it is a autoimmune condition or any sort of condition. Any life-changing diagnosis can be very impactful to the individual, but also for the caregiver and loved one. So it's very important for me as a caregiver to be there to support my loved one, to be there to not only be present, to understand the condition, and also to learn more about the condition, the treatment options, and what I can do to help support. And sometimes being there to be supportive just means being there.
Can you talk about what can be done from the provider's perspective to improve communication between the patient and their family caregivers?
You know, I've been working in healthcare for over 30 years, and I've been in different roles where I see patients coming in to the front desk and coming in to the medical assistant, to other medical professionals, to providers and specialists. And the one thing that I wish that patients could do is to feel empowered to utilize their voice. You know, like my sister always says, you are the CEO of your bodies, right? You can hire, you can train, you can fire anyone that you wish, right? Because you need to know how you can better hire or utilize the people that are helping you with your treatments. And I wish that people would have the opportunity to utilize their voice and ask the provider how they can help them and request that they ask them for what their needs are versus telling them this is what would be beneficial for you. Is, you know, being part of the care team means communicating with a doctor, letting them know what you want to get out of the visit as well, not just what they want for you to take home with you.
Sometimes voicing your health can seem difficult when no one is seemingly paying attention to you. What can people do to really get their voices be heard and break those barriers?
You know, there are so many barriers. You know, there's culture barriers, there's barriers in our, you know, just language barriers, so many things that we already face, right? The way we look, the way we speak, the way we interact with others. And I think, unfortunately, being a woman also gets that, you know, impact or causes that impact. A lot of women are dismissed. They don't get a sooner diagnosis. You know, unfortunately, men get, you know, we can go walk in at the same time with the same symptoms, having the same types of conversations, similarities to what we're talking about. And men will get a diagnosis sooner, treatment sooner, just because they're men. So I think it's very important to let women know and empower each other, and, you know, don't be afraid to use your voice. And if you're not heard, speak louder, because your voice does matter.
Voicing your health concerns, knowing your body.
So I think the one thing that I think a lot of people would benefit from is learning about what we are predisposed to. So coming from a Hispanic Latino community, you know, I know we're predisposed to diabetes, we're predisposed to hypertension, and, you know, other autoimmune conditions. So I think it's very important for us to learn about, you know, these conditions so we can be more aware of what to look for, so we can get a sooner diagnosis. You know, with conditions such as lupus, you know, when it starts attacking your body, you don't really know. It's an invisible illness. So it's very important for us to be aware of all these different symptoms and these conditions that impact our community. And in this case, you know, I'm speaking specifically about the Latino Hispanic community, that we are impacted by these conditions, including lupus. And a lot of minority groups, you know, that's what we need to do, is kind of work together and see how we can continue to raise awareness for these symptoms for an early diagnosis, and then also to raise awareness about how our culture impacts a lot of the treatments and the healthcare access needs that we need for our communities. And, you know, I think it's time for us to make this shift and change and stop just listening to people talk about how we need equitable care and we need to be able to have and provide the access, the same level of access to everyone, when in reality that is still not happening. You know, yesterday we heard something very impactful, and what is true. Let's stop talking about it. Let's stop talking about health equity. Let's stop talking about patient-centric care, and let's start seeing action for all of our communities.
How can people get in touch with you and your organization?
If you are living with lupus or any other overlapping conditions such as fibromyalgia or autoimmune condition, because we know that with lupus, there always comes a lot of other conditions, autoimmune, they just tend to just tag along together. Know that you have support, that you are not alone, and that we are here for you. If we don't have an answer, we will look for the resources that you need. You can reach out to Looms for Lupus, and we are together knitting a community of hope, tejiendo una comunidad de esperanza para nuestras familias, para nuestra comunidad. Nosotros brindamos más apoyo, brindamos más recursos y estamos aquí para ser su voz. We are here to bring more resources to you, to bring you tools to empower you, the one that's living with these conditions, the caregiver, the loved one. We want to empower you to use your voice. We want you to feel prepared when you go see the doctor. We want you to stand up and ask for what you need. And please reach out to us if you need anything. But Looms for Lupus can be found on every social media platform at Looms4 Lupus, y juntos tejiendo una comunidad de esperanza.